Hi guys, welcome back to my YouTube channel. My name is Edidion Udoeko. I'm a public health specialist and a health educator. On this channel, we talk about health and wellness tips. And we are also committed to talking about controversial health topics that people are too scared to talk about. Like, no one wants to be bashed, right? But we talk about all of that on this channel. So today we'll be talking about Caesarean session. We'll do a little comparison with vaginal births. That's what we'll be talking about today. And we'll also talk about the stigmas that surround it, especially in this part of the world. I mean Nigeria actually, especially in this part of the world, that's Africa. Stigmas and some other things that surround it. So please stay tuned. If you're a new subscriber, please click on the notification bell so you see when I upload videos. If you're yet to subscribe, what are you waiting for? If you're an old subscriber, you are the real MVP, like I always say. Thank you so much. Let's go. And to all the CS moms that will be watching this video, you know the saying that goes, not all heroes wear capes. You are the real heroes. You're beautiful, you're strong, and you brought life. You brought light into the world. So I'm here to send a very big shout out to you. So today I'll be talking about the stigmas surrounding Caesarean section in Nigeria and maybe Africa as a whole. As a CS mom, if you can relate, if you're a CS mom, you can relate. Some people, when they came to see you and your bundle of joy, they'll be like, did you give birth through not abnormal, they use normal delivery. Was it normal delivery or did you have a CS? They have that smirk on their face. Was it normal or a CS? I'm here to tell you today that both of them are like the same thing. It doesn't really matter. Bottom line is that baby and mom are alive and well. No complications. So today I'm here to talk about those stigmas. And bonus point, if someone does that to you, please do not take it kindly with them. Okay? Okay, let's get back to prim and proper. A cesarean section is a surgical delivery procedure where an incision is made in the mother's abdomen and uterus to deliver the baby. Now there are two types. Could be elective, that's advised by the doctor. Can also be emergency, an emergency CS, maybe because of maybe the mother starts to bleed, or the mom got into an accident, or you've labored for too long. You can be recommended an emergency CS. But elective complications like placenta previa, placenta accreta, breech presentation, uterine what do they call it, abnormalities, multiple births. That's generally complications that pose as straight and can cause severe hemorrhaging, can make the doctor recommend an elective CS. In this video, I'm also going to be telling you consequences, things that can happen if you actually disobey this elective CS recommendation. As you've seen, like I think about a month ago, I saw a man came out on social media, and he spoke about a particular hospital, that his wife passed because of negligence and what. It's not the first time we've seen stories like this. I remember one particular one, it was so touching. Like people really wanted to hear from the hospital what happened, only to find out that this lady the doctor recommended an elective CS, but the lady insisted that she would have to she wants to deliver like the Hebrew women. I don't know if she was there when Hebrew women gave birth, or maybe she was kind of like the midwife. I wouldn't know. She said she wouldn't give birth unless she had a vaginal birth. She insisted upon, like, you know, when these things happen, people tend to file lawsuits, and then they set up this panel, and then they investigate cause of death and all of that. So at the end, the verdict that was brought back was that this lady was advised to have an elective CS, and she bluntly refused. This one, I know it's expensive, but this one was not a matter of funds. She bluntly refused that she cannot have a CS. Her mother had like what number of children, and she had it through vaginal birth, and she had to have that baby same way, like, and she passed from complications of prolonged labor. So prolonged labor is like it has like consequences, and because of this experience, I found out that most people that pass, like, when they go to give birth, some of them, they were actually given like a recommendation. They actually told them, okay, this is the safest way for you to bring forth your loved ones, but they bluntly refused. They insisted on, before they recommend these things. I know, like, some hospitals, this is hearsay, I'm not trying to point accusing fingers at anybody. I've heard that there are times that people, like, some hospitals recommend elective CS because obviously CS is expensive. They do it because they want to like make money off the expecting parents. But if you are advised to have a CS, and maybe you've gotten a second opinion and you really need to have that cesarean section, I advise you do. You do not want to be contributing to already terrible indices in maternal mortality in Nigeria. So please try to listen to your doctor. Your doctor can recommend an elective cesarean section if you have any of these conditions I'm about to mention. The first one is placenta previa. Placenta previa is when the placenta is covering the opening of the cervix. So if you have a placenta previa, your doctor will recommend a cesarean section. That's because if you go ahead to try to push, you'd suffer a complication like severe bleeding. If you have placenta accreta, the placenta grows deeply into the uterine wall. Yes, so you'd be recommended, CS will be recommended for you, because if you try to push, you would suffer severe bleeding. You will be recommended CS if you have the condition called placenta accreta or previa, like I mentioned earlier. The third complication on my list today is if you have HIV or hepatitis. If you have HIV or hepatitis, your doctor will recommend a CS to reduce the risk of passing this to your child. You know, a CS, that the whole thing is, the whole surgical procedure, you can control. The good thing about it is that you can control risk of infection and all of that during the procedure. But if you're going to push, there is that little chance that you may infect your child. So if you have HIV or you have hepatitis, you'd be recommended CS. Another reason you'll be advised to get a CS is if your child is presenting in a breech position. In your third trimester, your child is supposed to like face, the head is supposed to be like sort of downwards, upside down. That's the normal birthing position, but it doesn't happen in all babies. Some babies, they do not take that birth position, and we call it breech presentation. Some of them present with their feet first, some of them present with their bum first. So if your child is presenting in breech position, you will be advised to get a cesarean section. Also, if you're carrying multiple pregnancies, like you're expecting twins, triplets, quadruplets, and what have you, you'll be recommended CS. It's safer for you and your babies. Also, if you have a pregnancy-induced condition like hypertension, you will be recommended CS. If you have uterine abnormalities, like if you have a myoma or fibroid, you're growing alongside with your baby. When you're pregnant, they grow to very unbelievable sizes. That's because of increase in production of estrogen at the time that you're pregnant. So if you have fibroids, your doctor your doctor will recommend a CS. Sometimes some people opt for a myomectomy alongside like the cesarean section. Some people opt for like a total hysterectomy. They just completely remove the womb, especially for people that's like the last baby. Also, if you have previous history of uterine surgeries, like you've had a fibroid surgery before this pregnancy, you've previously had cesarean sections, you will be recommended a cesarean section. Now, it is only fair that, as I've told you, the reasons your doctor may recommend an elective CS, it's only fair that I tell you consequences of disobeying that CS, that advice. So the first one is emotional trauma. Most people that go through like prolonged labor, long hours of labor, because like they want to give birth like the Hebrew women, most women that do this, they go through so much emotional trauma, anxiety, postpartum depression. You hear some of them after like the first baby, after the first baby, they'll be like, never, I will never go back again. And they actually mean it. I don't mean people that say they will not go back to the labor room and end up giving birth to 4 more. It leaves like a lasting scar. Even for people that, okay, they actually went back, but you always hear amongst mothers, oh, this particular birthing experience scarred me. You always remember it. So it gives you this emotional trauma. You do not want to have that trauma. The second one on my list today is fetal distress. I know I've been talking from the beginning. I've just been talking about on the side of the mom. A lot can happen to your baby when you disobey an elective CS advice. Your baby, you put your baby, some babies can be in fetal distress. If you're going to have a prolonged labor, you're going to labor for so long, this can lead to birth asphyxia. That is when your baby is deprived of oxygen, especially if your water has broken. When your baby is deprived of oxygen for a long time, it can lead to brain damage and neurological problems like late development. You don't reach time for your pikin to the waka. You know the waka. Do you understand? A lot of things can happen. A lot of things can go wrong. You do not want to put your baby in that situation. I know you're sitting at the comfort of your home, and right now you're watching this video. You're like, hey, you're talking about this CS like it's very cheap. It's not cheap. It's expensive, especially if you don't have medical insurance. But I'd like to think that pregnancy and childbirth is, how do I call it? It's a conscious decision, a conscious effort. You have like 9 months to plan. Trust me, if you decide to do it your own way, disobey like your physician's advice, if you die, you'll see people that will donate coffin. I heard coffin is like 400,000 now. There are people that will be out to sponsor that party. They'll do it like carnival. So is it not better that you solicit for help? Speak up, solicit for help. Do not insist on doing it your own way. Solicit for help. Oh, please, I have to go through this CS. Just try to get help from these people. I know it's not that easy, but it's better you tried. So with that said, let's move on to the next complication of prolonged labor. If you have a prolonged labor, you can have risk of infection, especially when your water has broken. You know that water is like water from the amniotic sac, and it has its function. It protects your baby from infection. So you're at risk of infection if your water has broken, and for a long time you're still laboring without bringing forth. You are at risk of infection. You're also at risk of postpartum hemorrhage when you labor for long. Prolonged labor can cause this. Another thing prolonged labor can cause is tissue damage. Did you know that you can get a fistula from prolonged labor? What is a fistula? A fistula is an abnormal connection between the vagina and the rectum or bladder. You see people after giving birth, they start leaking urine or feces. They have a fistula. It can be surgically repaired. Another thing that can happen to you is a uterine rupture. Your uterus can actually rupture if you've had like previous births and it's weakened. If you have a prolonged labor, you can actually get a uterine rupture. I think these are enough reasons for you to have that CS. Forget about what people say, just have that CS. And then the last one on my list, and I don't know, this is the most solemn one. If you insist on having a vaginal birth, you can actually die, like from complications of what led to suggestion of that elective CS can actually take you. So please look out for yourself. Forget about what people will say. And I want to also take out time in this video to call out people. I know I've already called you people out, but I'll still call you out. To call out people that go to visit newborns and their moms. You just go. You did not see Pampers to buy. You did not buy tissue. You did not buy wipes. You went there. You did not help out with household chores, knowing how the situation at the time is. But you had the nerve to go and sit and ask, was it natural delivery or was it CS? What is your business? I want to know. What is your business? What is your own inside that one? Change. And for husbands, that when your wife is recommended CS, you go, oh, my mom had 8 of us. Yeah, because it's always 8 of you people. My mom had 8 of us naturally. I cannot pay for. You're not strong enough. You're not competent. My mom had 12 of us naturally. Why do I have to pay such outrageous amount to keep your wife and your baby safe? That's why you have to pay that outrageous amount. So please, this is like something that we shouldn't be talking about. I'm even embarrassed on your behalf talking about it, that you have to discuss your wife and your baby's life. Like, you have to discuss it because of money. You have to put it beside monetary value. It shouldn't be something that I'm embarrassed on your behalf. Like, I'm so embarrassed on your behalf. So please, let's do better. You'd be surprised that women that have babies through cesarean section, they have like higher risk of, it's a surgical procedure, they have higher risk of infection, like the wound site. Some people, you'd be surprised, they have this wound breakdown. Maybe they didn't manage the site properly, they didn't clean well or something, so that site gets infected and they get wound breakdown so bad that they have to stitch again. So someone takes out time and loves you enough to make that sacrifice, and all you can think of is money, or what will people say? My friend's wife gave birth naturally. Well, I want to tell you that pregnancies are not the same. Female bodies are different too. Everybody's, I think, people's body, like, they differ. It's not just females, from person to person. Apart from phenotypic features, people's bodies differ. So please, let's do better. And please, I want to remind us, no insensitive questions. When you get there, congratulations and move. Thank you for tuning in today. That's where it's going to end for today. Thank you for tuning in. If you're a new subscriber, please, if you've not subscribed, please hit the subscription button, click on notification bell, drop a comment. Yeah, what do you think about a cesarean section?